Still got coffee. Oh, we got coffee. We got speed. We are live. I'm going to spend some minutes talking about your knees. Got a knee here. This one has been in better shape. Somebody got a patellar ligament tear. So I want to talk just a little anatomy, real briefly, to discuss sort of what's in here, why knees can hurt, what we can do to sort of get them less painful or to bulletproof them. And understand too that there aren't a lot of muscles that live right here that impact the knee a lot. Okay, there's one in the back; it's not shown. There's several, of course, in the front, but their main job, while it can extend and flex the knee, they don't do a great job of controlling this. And this is the place or the sort of direction we get injured in here. These are the structures that we typically hear getting torn, degenerating, brain, whatever. These are your menisci, right? So you have this is, okay, so your medial, the inside. So this would be, from my perspective, my right knee, or a small person's right knee. And so you've got your meniscus on the inside. You've got your cruciate ligaments, your anterior and your posterior cruciate ligaments there. You have uh, you'd call ligaments on the sides, but really these are just thickenings, and this is just a representation of a thickening of the capsule that holds this all together. So this is like got a cellophane bag around it, and that holds everything inside this joint. So if we injure something in this space and we don't disrupt this bag, this cellophane bag, this connective tissue bag that holds all that stuff together, we get a swelling inside, and that swelling will feel to the user, person who owns the knee, like a water balloon in there. Like it's mushy. There's something inside here, not a physical thing, but something that is restricting motion. And so if you think about this being a water balloon, and I fill that water balloon with water, I literally am going to float this up a little bit, right? I mean, it's just pushing pressure. So I should feel less stable with a very swollen knee because you are less stable. You might have some pain in the places where you have injured that structure. So let's say it's a meniscus injury and you tweaked it by turning or twisting hard or doing too many reps of something, and you injured it or have an intra-articular injury, so inside of the joint, and that will cause the swelling and all other things. Now, if you tear that bag, that cellophane wrapper, that thing that holds all this fluid inside, and you tear it, so you tear the MCL. See, that's stretching out. I could probably rip it if I wanted to. And that's a great picture of an MCL, but now the bag is open. So now we have blood, fluid, stuff going on in here. But we might get that bruising to sort of fall down towards the calf, the foot, the toes, those kinds of things. So these are signs of sort of what's happening on just around this structure. Now, there are other things that we listen for when someone says, my knee hurts. We always ask whether or not knee is buckling or locking up. And many folks confuse pain that stops them from moving with buckling. Buckling would be I'm walking along and suddenly one of my knees gets totally stuck, and I go to swing it forward and it just doesn't swing. I might fall down or be able to catch myself, but you're not going to feel it. I'm sorry, did I say that wrong? Locking will be stuck. Buckling it'll just be kicked out from underneath you. So the idea that you're walking along and then this thing, which is sort of just floating around, just kind of loses its position, and then now this leg, which is trying to hit the ground, doesn't have anything on top, and so the knee will give way and you'll hit the ground. And that happens many times when we have a disruption of the edge of these cartilage, right? Because you can see it forms kind of a cup, right? And if you disrupt the cup, this can just kind of slide over the rim. And so those tears lead to kind of that buckling sensation, right? Those tend to be ones that can heal well on their own because they don't absorb 100% of your load on the top of them. So if you injured your meniscus in here, the innermost part, or we call like the white zone, we call it that because it doesn't get a lot of blood flow. Your body weight at rest is almost always squeezing down on them, even if it's very little. And so where we can limit blood flow, we will limit healing. And so that's one of the reasons why we want to promote blood flow in many cases for healing. So those are some of the structures. Okay, we had, again, recap. We got our menisci, the fibrocartilage rings. We have our cruciate ligaments. We have our mediolateral ligaments. And then we have our whole bag that kind of covers the entire thing, our synovial capsule. And now we have a representation of what's happening on top. The quad muscles all coming down to attach to what used to colloquially be known as just the patellar ligament, right? Or patellar tendon. So people would say, oh, here's my patellar tendon from here to here. And I'm like, sure, we can call it that because, as you know, I want to just tell folks where we're looking. Specifically, the patellar tendon is the portion that is above, and the patellar ligament is the portion that is below. And so when someone tears their quad tendon, I say, well, above or below, or tendon or ligament, because this, not a terribly, well, it's not, none of these are common, they're kind of rare, but this one, a better, easier fixation afterward. This one, there's a lot of trouble with this because this is a lot of soft tissue that has to knit together. And a lot of them happen here. If you're lucky, you get one here. But again, that's a really rare injury. And then you have structures down here. This is an important one for when we're talking about knee pain. This is your tibial tuberosity. It's the thing that this muscle attaches to. Okay, so it's how when your knee is bent like this, that's here. This muscle gets shortened. You can see then how this is going to come up, right? So that extends the knee. And so what can hurt? Well, we talked about how meniscus can hurt. If you tear an edge, you can buckle. If you have a tear that flaps into the middle, you can be walking along and then suddenly the knee gets kind of stuck in a certain position and then it has to be sort of wiggled out so it can be moved freely again. You can have tears to the actual synovial structure, which cause blood to fly around and makes it a little confusing. You can have injuries within the joint that make this bag fill up with fluid and makes you feel like you're unstable. And then you can have injuries to any of the surfaces that touch. So you get the patella, right? You can hear that? That's one of the funniest things when you have somebody with a knee replacement. If you got a mom, dad, an aunt, uncle that has a knee replacement, have them lay with the knee straight. And if they've had one within the last bunch of years, when you tap down, you hear it clack, 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 because you got a metal ball and a plastic thing here, and it's pretty fun to show them that their knee collapsed. Anywho, that gets replaced because that is a very common area for wearing away of tissue in an abnormal manner, right? Arthritic changes to joint surfaces are normal as we age. Whether or not they stop you from moving is a whole other thing. How heavy are you? How strong are you? How flexible are you? How coordinated are you? How well do you feel and look to move around? These are all factors that are going to change how we sense pain here, and not only that, but how we can address pain and how we can address bulletproof in this area. So like I said earlier, and this is probably how I'll wrap this guy up, we don't have a lot around the knee to move the knee or protect the knee. The stuff that does that is above it and below it. Okay, the hip has this big, strong rotary muscles. They can move your leg in all manner of directions, in, out, sideways, rotation, and all that kind of stuff. You have muscles at your foot that can take this lower half and push it sideways and bring it forward or backward or twist it or rotate it, depending upon what the ground is feeling, right? So when we talk about the knee, I like to say that the knee is the middle child of the lower extremity. It will do everything the hip and the foot says it has to do. And that's how we have to treat it. We will address pain concerns with offloading things. And so if we know down the stairs with this knee, because you've got a patellofemoral injury, hurts, okay, well, let's say, we'll limit that for a while. But while we limit that, or while we optimize the healing process for that area, we're going to make this hip and this foot real strong so that when we have this healing completed, these movements that happen in this plane that you don't want to happen will not happen because the muscles will be strong enough and coordinated enough to hold that all together. And so we optimize healing by just making sure we offload structures that are possible, and then we optimize the never come back to clinic process by making this stuff so strong that I can dare you to go get hurt and you wouldn't do it. So why your knee hurts? Weird rubbing, asymmetrical rubbing, too much banging, or you injure any number of these structures. We have a zillion tests that we do here to test out, okay, wait, did you injure your ACL or your PCL, your MCL or your LCL, your popliteus or your hip muscles? Like, whatever we've got to find, we will find. But all of it is in the process of locating what is specifically making the knee hurt, what mechanical things can we address, what pain things can we address, what healing things can we address, and then we just load you up. So that's why your knee hurts. Stuff rubs, lots of stuff. It's okay. Knees are not supposed to hurt, but when they hurt, get some information and you can make them stop hurting. All right, guys, have a great day. This was a good one. Maybe we'll talk about my favorite joint, the shoulder, next time. All right, or ask some questions. Peace.